this is one thing that tends to get missed. So vitamin D is more of a hormone than a vitamin. So it's a little bit misnamed. But hormones in general, they keep away inflammation. And by doing that, they keep away disease. And so with vitamin D, every cell in our body has a receptor for vitamin D because every cell in the body needs vitamin D to function optimally. Now, we've become very bad at making vitamin D from sun exposure. So ideally, when we run labs here, we want people's vitamin D levels to be between 70 and 90. And lifeguards in San Diego, California, are in the mid 40s. And they got great tans. They're on the beach all day long.
Wow.
You know, in San Diego, way far south of us here, they're like 40 points lower than they should be. So it's really hard. So unless somebody's on the right dose of vitamin D supplementation, they are tanked and their bodies are feeling it in a bad way. And so you have to have vitamin D just right. And there's ever so many studies out there. If you Google, if you go to PubMed, which is kind of the Google search engine for scientific stuff, there's, I think I maybe started lecturing about this like 7, 8 years ago. There's over 11,000 references to vitamin D. And there's so much data about this. But we have to have receptors on our cells for the things the cells need. And so you hear a lot about like insulin resistance, where the pancreas might be making insulin to control blood sugar. Every cell in your body has receptors for insulin, but those insulin receptors can become resistant to insulin. Insulin can't attach and do the work. It's almost like you don't have insulin, blood sugar goes up, move towards diabetes. So vitamin D receptors can become resistant too, but what we have figured out is that there's more vitamin D receptors in the gut than any other body part. And when the researchers figured that out, they were thinking, well, wow, this must mean that vitamin D is really important for gut health. Well, it turns out those vitamin D receptors can become resistant to vitamin D. And then it's almost like you don't even have vitamin D. You can have all the vitamin D in the world, it can't attach and do the work. And so what tends to happen in the gut is it disrupts the intestinal microbiome. So you start losing the good bugs, you know, the ones fighting your battles, start building the bad. The lining of the gut will actually start creating inflammation, such as increased production of a really nasty bugger called NF-kappa beta. It creates all this the gut is actually making inflammation to destroy itself. And this is where you kind of hear this term where the gut can become the engine of inflammation throughout the entire body. But then the lining of the gut also stops making proteins designed to keep bad bugs down in the gut called antimicrobial peptides, AMPs. So then they get a chance to rise. And it's such a huge central mechanism for everything. So back in about 2018, they figured, hey, if you can fix this vitamin D receptor resistance, optimizes up intestinal microbiome, lining of the gut stops making inflammation, lining of the gut starts making the antimicrobial peptides, keeps the bad bugs down. Wow, that is a central mechanism in gut health, but what it turns out is it's actually the central mechanism in like everything. And so the original data was like, wow, this seems to be so profound. Not only is this exactly what you want to do to turn around ulcerative colitis and Crohn's disease, the autoimmune diseases of the gut, recurrent C. diff infections, recurrent H. pylori infections of the gut, which are notoriously hard to get rid of. But they go, oh, this kind of looks like what you want to do for about everything else. It probably works for cancer prevention, heart attack, stroke, diabetes, all this kind of stuff. Well, the exact same researchers 6 months later published this huge article calling correcting the vitamin D receptor resistance in the gut is a nuclear weapon, quote unquote, in the title of the article, nuclear weapon against diabetes, against metabolic syndrome. So you can turn around and prevent diabetes from this. But then all these subsequent articles since that time have said, oh, well, yeah, if you can correct the gut this way, like the Harvard Journal of Psychiatry about 2 years ago, it goes, hey, when you can fix the intestinal microbiome this way, and I'm like, oh, well, that's fixing the vitamin D receptor, you can treat major depressive disorder. And another article came out, well, if you can get the intestinal microbiome to do this, I go, well, that's fixing the vitamin D receptor resistance. It changes personalities. People become more outgoing, more social. So it has this huge impact on brain chemistry. But what you got to do is a combination of three things. Is daily vitamin D, daily probiotic, and daily butyrate.